Welcome to this podcast from the Medical Journal of Australia. My name is Sally Block, the MJA's news and online editor. This week we look at improving the health of children and young Aboriginal and Torres Strait Islander peoples through participation. The MJA acknowledges the traditional owners and custodians of the land on which we live and work across Australia. This podcast was recorded on the lands of the Wangal people. I pay my respects to their elders past and present. Dr. Jordan Corey is a Kamilaroi woman and Bonnie Dukakis, a Gundichi Mara woman, who were co-authors of an MJA paper on participation of Indigenous children and young people to improve health and well-being. In this podcast, they talk about that paper and many other aspects of the health of young Indigenous people. Cultural safety is explored and described as not just another ticker box alongside fire training in an organisation, but an evolving commitment. Bonnie Dukakis is the CEO of the Koori Youth Council in Melbourne, and we find out what they are doing for Indigenous young people. Can you tell us about your paper called Participation of Indigenous Children and Young People to Improve Health and Wellbeing?
We wrote this particular paper addressing the historical exclusion and non-participation of Indigenous children and young people in social services, including healthcare services. Yeah, we wrote this perspective paper to draw attention to the issue, as well as a community grassroots organisation, Koori Youth Council, which has done some amazing work at improving this across the state of Victoria in Australia.
I think how this piece as well came together was around a collaborative piece, so acknowledging that in terms of our work, we are known for working with young people and elevating the voices and aspirations of Aboriginal and Torres Strait Islander young people, particularly living in Victoria. Without having the health background concept, how do we bring in the right people in the room to elevate what we know and what we hear through our work into different spaces and different platforms? So in this instance, being able to partner with Jordan as an expert in the health field, but also including Vic Health and other Aboriginal voices in this piece, I think was really important. Being able to highlight and showcase how Aboriginal ways of knowledge, Aboriginal ways of doing business can really inform how we respond in different sectors and different spaces, and things to consider outside of the areas that we're known for. It's important.
And probably one of the things to highlight as well about this paper is all of the authors on this paper are Indigenous, myself being a Kamilaroi woman, and we've got a wide range of representation from different Indigenous communities across Australia. And we also have included young people's voices in the paper. And I think that's a really special thing about this paper is it's entirely Indigenous, self-determined, and has the perspective of young people embedded in the paper from the inception rather of the idea.
And what were the key themes there?
My perspective as the Koori Youth Council and as the CEO here is ensuring that we're able to share and the understandings of what participation can look like, what that looks like, how it can be informed, and how we can ensure particularly young people can have a say in issues important to them or impacting themselves. So we hear a lot of examples and buzzwords around particularly youth participation in different sectors, and it sounds really good and it's something that makes so much sense. But when we actually unpack it a little bit, there's a lot more to participation than to just being present. So and I might draw attention to and might be jumping a little bit, but in terms of from Koori Youth Council, what we've understood. So we developed a resource called Waipunga, which means supporting young people in Dja Dja Wurrung language. And it's a resource that's web-based, that's actually around mapping out what Aboriginal youth participation looks like. And we've done this in a way of consulting with young people that access services, as well as service providers that work with young people. And it's done in an Indigenous lens. It's looking at what does it look like for Aboriginal young people. But what I've seen, it actually gives a lot of language around what good youth participation can look like with not just Aboriginal young people, but with other young people that I've also worked with around understanding and having the knowledge first. So where you're working in, what that looks like, what are the values that you have and you align with, before you get to action. And I think that's as well something that we wanted to highlight in terms of participation is a spectrum. It's not just a one entry point, and it's not just a once off. It's actually a process. And I think it's how we can look at embedding that in our work, whether that's through direct work with clients and patients, or whether that's through system reform, or whether that's through organisations and different structures. I think this could be implemented in different ways in different layers as well.
And I think just to expand on that, Bonnie, I think also sort of the main themes that we touched on as well in the paper is participation as a social determinant of health. And I think when people think of social determinants of health, they're often likely to think about the socioeconomic status of individuals, families and communities. And participation has been recognised, but is sort of one that isn't spoken about as much. So that was sort of something we wanted to draw out, and particularly around participation being a spectrum. Often it's treated a bit more like a tick box. It's sort of done at the end of being like, have we done this part of, whether it's in medical research or, at the end of the consult, there might be the question to ask the patient to now participate and ask questions, but rather than that sort of being throughout the consult or at the beginning of a research project. So really, we wanted to draw out the fact that participation can sort of range from non-participation all the way to self-determination. And so we've drawn out examples of that in the paper.
You've mentioned Indigenous concepts of health. I mean, obviously it's very broad, but how does that different, and how does it need to be treated different?
So Indigenous concepts of health have been different, I think, to Western concepts of health. And a part of that is thinking of health as not just a moment in time, but health across a lifespan, as well as inclusive of health not just as an individual, but of a family and a community as a whole. So it's a lot more holistic, and also not as time-bound, I think, as Western concepts of health. So really, when we think about health, we're thinking about health of the whole community, and that's something that I think is different from Western and biomedical notions of health. It also includes, I think, social and cultural concepts of health, which include connection to land, country, as well as caring for land and country. So the health of the land and country that you're on is also considered to be a part of your individual, family, community's health as well. Bonnie, is there anything you'd like to add to that?
The only thing I'd like to add, I think, is about it might have been seen before, but the social and emotional wellbeing wheel. I think in terms of looking at what is Indigenous concepts of health look like. And Jordan touched on a couple of those points in terms of the importance of looking at self, but also looking at what are all the intersecting needs around that. What is that connection to country? What is that connection to spirit? What is that connection to others? And those things that you directly have influence over, but then also what sits around that impacts those connections and impacts an individual outside of our control and outside of an individual's choice, I think is important. And when we look at our Aboriginal community controlled health services, I think they've done it really well in looking at a lifespan. And I can't quite get the right language on what I've heard with some of them, but and touching on the importance of their involvement from pre-birth to dreaming. And when we talk around dreaming, it's like further than just a passing. Like, what does that look like post that? And our services do so well in incorporating that in all their business and how they do business. I've seen is quite different than probably mainstream in that. It's my own language. I think maybe and Western culture's acknowledgement of what that looks like. It's generally staged. Like, we look at lifespans or like life cycles at different points and key points. And what I've seen through my experience as well, our Aboriginal community controlled organisations and health workers look at life across as a journey and not just singular moments as well. I think that's something that differs.
And I think we could direct the listeners to Professor Graham G. and et al.'s work on social and emotional wellbeing and the wheel that Bonnie's talking about there.
Participation of Indigenous young people, why is that a priority? You have covered some of that as well, but what would you like to add to that?
I think one thing that people probably aren't familiar with is that Aboriginal community is actually quite a young population. So when we look at the median age of Aboriginal and Torres Strait Islander young people, or Aboriginal and Torres Strait Islander community, the median age is actually under 25. So we're a very young population, and I think that's where there's such a big focus within Aboriginal communities around how do we elevate and include young people to build them up to understand structures that exist, but how they can not just understand them, how can they inform them, how can they participate, I guess, is the big part. And I think it's something that we've done, and I look at that all communities can learn from in terms of how young people have engaged and participated and really led the way in how we keep our communities safe too, I think is important, and how we can pivot and really acknowledge things ahead of the curve might be a way. Like we've spoken about some of our health promotion strategies. Like, it's not an area I'm entirely familiar with, but I can recall even being in high school around what some of the campaigns were going on in terms of understanding healthy relationships, understanding impacts of sexually transmitted diseases, and done in a way that we're getting information out and providing it in a manner that I haven't quite seen in Western ways or in mainstream organisations doing it to the same level, around bringing in the people that are really going to be able to drive home the messages that we need to support health participation as well.
Okay, I was just going to also add in there, the other reason that we believe that participation of Indigenous children and young people is so important is that children and young people are the expert of their own lives and can provide some novel and unique ways of defining as well as helping solve some of their own health needs. And I think there's some really solid examples, particularly around COVID response, anti-vaping campaigns, anti-sort of STD and sexual health campaigns that are evident to that. And a lot of that is about tapping into and appealing to Indigenous concepts of well-being and worldviews. It's not often you'll see in those campaigns, it's about the health of the whole community. It's about protecting auntie and uncle, nan and pop, not just yourself, which is a different, I think, than the sort of, again, mainstream campaigns. The other thing that we touched on in the article as well is about the higher health needs of Indigenous children and young people. And while in the article, we deliberately didn't use statistics, we mentioned the higher rates of ear disease, eye disease, heart disease, death by suicide, developmental delay, mental health, it goes on and on. But one of the things that we really decided to do was not to use the statistics, because those statistics are out there, and I'm sure the listeners are very aware of the health challenges in communities. But I think there is a need to create services that are responsive to individuals and communities. And if we're seeing higher rates of those diseases in communities, then surely we should be talking to communities about what sort of services they need and what sort of services they're going to use and trust. So that's part of the reason why we think participation, particularly of young people whose stories are often told for them, if at all, so important for them to be at the table. And I think, an example that Bonnie and myself were speaking about before this podcast was about thinking about the empty seat at the table whenever you're sort of making a decision or in a room, whether it's government, health service, even a consult room, is thinking of an empty chair and using that analogy to be like, who isn't here? Who am I speaking for? Who should be here? And really thinking about, hey, where is that voice? Is there a way to, I guess, hear the people that aren't here and should be here or should be heard from, and not as an afterthought, but early in the process? And I think that's one of the things that unfortunately government hasn't sort of been on the front foot in, that historically is having people in the room at the beginning rather than sort of at the end of a process. And so that's something that we really wanted to champion as well. And I think Career Youth Council is an example of basically community doing it themselves and sort of not waiting around for government to pull up their socks to like, we're going to sham, and get on the front foot about self-determination and making sure that Indigenous children and young people are enabled as much as possible and in charge of their own futures.
Could you tell us a bit more about the Hear Me report?
Yeah, so Career Youth Council developed a report in 2017 called Nagaji, which means hear me in Woiwurrung language. It was at a time in Victoria where there was a lot of public media attention around the state of the youth justice system in Victoria. And generally quite negative, a lot of people talking about young people and what's needed. And what we actually did was go and speak to 42 Aboriginal and Torres Strait Islander young people who were currently or previously in the youth justice system here, not just around their experiences, but around their aspirations and what they'd like to see. So we developed this report, which tells 3 composite stories of young people. So through the ethics process and how we could make sure young people could participate. We're not able to share who was involved and what that looked like, but we were able to tell their stories in a way that other young people could relate to. And even though it was done in 2017, the stories that are there are still so relevant to the solutions that we like to see now, and particularly looking at community-led responses. How do we ensure that we not just push expectations onto our communities to deal with this, but actually resource them, actually prioritise community-led responses and empower that, looking at how we can ensure that young people can have their voices heard and see the impact. I think some really strong themes came through, and you can look at that on our website or you can watch some of the short clips in that, and we saw that the impact that had really set the way forward in terms of policy reform and how policy makers actually complete reports and submit reports. I look at it as the way there's even research about Aboriginal communities being the most researched communities. And so this was quite a different piece of work where we said, rather than retelling and expecting everyone to retell their stories, it was actually a way that young people's stories could be told. They didn't have to keep retelling and feeling like they have to be justifying some of their experiences. And I think we've seen a little bit of a shift in terms of how that's been implemented. But I think one of the key things post that, the Commission for Children and Young People actually did an inquiry, systemic inquiry into the overrepresentation in Victoria, and developed a report called Our Youth, Our Way, which really built on some of the ideas and solutions we put forward in that piece as well.
And one of the solutions that that Career Youth Council suggested was raising the age that the state was supporting young people when they were leaving out of home care from 18 to 21. And that, I think, through the advocacy of Career Youth Council, as well as a number of other community-controlled organisations across the sector, the Victorian government was responsive. While there are plenty of other recommendations in that report, it definitely shows that that sort of approach was successful in some areas.
So, speaking to that, what can individual health practitioners do to improve the participation of Indigenous young people?
Very good question. I think, firstly, I think starting with an acknowledgement that whether practitioners realise it or not, they are definitely coming in contact and with Indigenous people, whether you live in a city, regional area or remote. I think that there's a sort of stereotype of what and where Indigenous Australians live that is false, because most Indigenous Australians actually live on the east coast of Australia throughout our major cities and regional centres. So I think in that sort of awareness is important. And then I also think that commitment to, I guess, not being an expert, which I think is really hard for health practitioners to do and hard for doctors to do as well myself, is accepting that you're never going to be an expert on all Indigenous peoples in Australia, and cultural safety sort of isn't a tick box next to fire training. It's something that is an ongoing commitment, really. It's about continuing professional development, I guess, if you want to view it in that sense. It's going to be different. There's going to be challenges along the way, but really looking at to improve your practice and with curiosity, I think, is probably the main thing. Bonnie's mentioned the Wayapunga resource as well. That's also something that practitioners can familiarise themselves with. And then I think, there's examples that sort of come to mind for me is probably like around failure to attend. I have colleagues and family members that work in healthcare, and the amount of child protection notifications that come from failure to attend is astounding. And I think that it's kind of a kicking the can down the road sort of approach in my view, because rather than a curiosity about why couldn't this family come to this appointment, it results in a knee-jerk child protection notification. And then it turns out, oh, actually the appointment was scheduled at 3 p.m. in the afternoon and the family have to go and pick up the other kids from school, and that's why they couldn't come to the appointment. It's, I think, also just thinking about how health services are designed, and they're not really designed with people in mind. They're often designed with diseases in mind. And I think that really needs to change. And yeah, I think that individual practitioners can sort of push for that change from within by having a curiosity about why there might be a fail to attend rather than just the knee-jerk notification, and sort of, I guess, looking at more person-centered care rather than sort of, I guess, fear of litigation or, just focusing on the community and the often patient's family and what barriers they might have to accessing that service.
It's really interesting. Some really good points in there, especially, we have a disease-centered kind of focus as opposed to person-centered focus.
Something that I'd love to see happen more is around creating spaces for young people in particular, whether that's sort of children as they grow and, mature into adolescent and young people, is around creating spaces for those individuals to become engaged in their own healthcare, creating spaces to ask questions, doing that sort of iterative feedback. So tell me what you heard me say, what to see whether the child is engaged in that conversation. I mean, most practitioners would know that patients walk away with about 20% of what you've said in the conversation. But I think young people, and particularly where there might be lower health literacy or fear of a health service, and some patients or families might be in a bit of a fight, flight, freeze response, just showing up to the hospital where they've got, historical sort of negative associations of hospitals being places that have taken kids away from families. And I think that's something else that a lot of people might not know is the health services and systems, hospitals, GPs were all sort of complicit in the stolen generations. So just being aware of that and finding ways for people to engage in the health service, engage in the consult, and ask questions. And that's also something that I think higher income families are sort of typically better at promoting kids to engage in the consults. And there's research backing that around, can you ask the doctor a question? Do you have any questions? But I also think that's on the practitioners to be asking the children, do you have any questions? Not the caregiver that's there with them. That should really be a part of our built-in practice.
So that tie into what you're saying about services not being colourblind?
Yeah. So I think that there's a tendency to think that one size fits all in health. I think we can see that in our hospitals, and I think the community controlled health services, so AMS's, Aboriginal Medical Services, understand that that's not the case. And that's been a part of the reason why they came to be in the first place, was basically a response from the community themselves saying, hey, we don't feel safe in these traditional hospitals, or they're treating us on the veranda, not in the clinic itself. And that's how the Aboriginal Medical Services really came out. And like an example I like to sort of share with people is that the Royal Women's Hospital was founded by one of the first female graduates of the University of Melbourne. And it wasn't until a woman graduated medical school in Melbourne that there was, I guess, the need was defined that, hey, we need a hospital that is women's specific around obstetrics and gynecology and women's health issues, recognizing that's a whole area of medicine that needs to be prioritized in a safe environment. And I think that sort of in a different way has happened in Aboriginal and Torres Strait Islander communities. I think there's a bit of a parallel there, I guess, with people are much better at being able to define their own needs, and it's harder for an outsider to define others' needs. So again, another example of why it's so important that we have as many diversity at the table and have the people who are most impacted by decision making or who have the highest health needs at the table. Whoever's, is the service is trying to deliver to, then they should really be there helping to define what makes that service trustworthy and accessible.
Yeah, it happens so often. Now, we talked about red flags and amber flags. Can you talk to us about what that is?
So the red flags and amber flags came up through, I guess, shared discussion amongst the authors of the paper, as well as some of, all of our lived experiences in working with different organisations, typically, mainstream organisations who might have very good intentions to prioritise participation of Indigenous peoples and maybe even Indigenous young people, however, often fall short. And so the red flags are what we call red flags of performative non-participation. And that language comes from Sherry Arnstein's paper, who wrote about citizen participation. And we've sort of come up with these 7 red flags, which sort of are what we would call a tick and flick for the sake of participation rather than a genuine engagement with the community. So the 7 that we talk about in the article are use of buzzwords, only employing sort of a single person of a minority group. So having one Aboriginal employee typically. Thirdly, lacking an authorising environment. Fourthly, not valuing labour. 5, we also we all agreed that they often commodify community connections and cultural knowledge and don't encourage sort of any challenge to that or questioning whose interest that is it in the interest of the community to sort of share those connections and knowledge, as well as sort of the organisation lacking culturally safe critical allies. And lastly, the 7th sort of red flag is around lacking mentorship, career progression or development. And often serving these organisations, there's a lack of Indigenous employees at an executive level, and that single employee is often tasked with the monumental, if not impossible, task of cultural change across an entire organisation.
And finally, what can Australia do better?
I think one thing I might add as well, just in terms of thinking for the listener and like in whatever field you might be, we do talk about examples around Aboriginal community-controlled health organisations and Aboriginal medical services. If you're not working in one of those, like there's still an importance to be responsive to the needs of Aboriginal community and young people. And we talk a lot about the importance of choice of service too. So I think Jordan's given some really clear examples from a practitioner's perspective on how you can do that and how you can think about what it looks like in your own practice. And I just want to go back to that too, just because I think it's important that even if you might not understand or know that your patients or clients that you're seeing are Aboriginal, sometimes asking the question is the first point. If they're identifying as Aboriginal or Torres Strait Islander, I think just giving the confidence to do that and the importance to understand then how you can best service them and how you can best offer supports and services responsive to their needs. And I think that's the important thing with this participation piece is around knowing what that looks like, and it can look many different ways in whether it's your own practice, whether it's within the organisation and service you're working in, or whether it's at that higher level strategic and advocacy around improving Indigenous health outcomes. I think that's an important piece that I wanted to make sure we covered too. Like I'm not dismissing the work that our services do, and they do a lot of that really well, but like being an Aboriginal woman myself, and I feel like I have a fairly good understanding, but even just for me, I still struggle going into some of these spaces, not being the expert and not being very clear because some of these things weren't taught to me growing up. So I think just acknowledging that whether or not the person in front of you might appear very competent and very comfortable, like I think I still have a lot of questions and probably do a lot of things or probably could ask a lot more myself. So just thinking like how we can best respond can look many different ways. And I think challenging assumptions. So thinking about like research pieces, and whether that's been through your studies, whether that's been through professional development. I think just in even something that Jordan said before, like cultural safety and what that looks like isn't a tick a box. It's an ongoing learning, and not just for practitioners, but also for Aboriginal people as well. Like I sit here and I don't know everything. I'm still learning. We'll continue to learn. And I think that's something that I really take away from working with communities. I think there's strong mentorship element, and I think that that's something that's really lovely to see in how we build up individuals and how we can support that. Jordan?
Yeah, could I add also one more thing before we jump to what Australia can do better? Would just be, I guess, one of the things that I would love to see is more partnership between mainstream services and community-controlled services. I think there's the potential for a lot of duplication, and I just think community-controlled sector has a lot of knowledge and expertise, and I think that I've seen it work very well when, for example, the ophthalmologist from the Royal Victorian Eye and Ear Hospital walk down the road to Victorian Aboriginal Health Service bars and see patients there. Sort of it's a simple movement really. It's about, I don't know, for your listeners that don't know how close they are, it's about 500 meters away. But for the ophthalmologist and the eye team to come down to VARS, the community controlled sort of services, it's about meeting your community where they're at. And they're not at the Royal Victorian Eye and Ear Hospital, they're at VARS. So that simple step is really about increasing the accessibility of services to people who have very reasonable historical reasons for distrust of traditional mainstream services. So I think that's an example of partnership between services that I'd love to see more of.
That's so interesting.
And then what can Australia do better? I think the main thing one of the reasons that we wrote the paper, I think, is because I'm just in awe of what KYC, Career Youth Council, have managed to achieve with relatively few staff across the state of Victoria, this grassroots research and advocacy. And it's a shame, and a national shame, that there isn't the equivalent of a Career Youth Council in every state and territory in this country. And so what I would love to see, and part of the reason that we wrote this paper was to showcase the work that these community-controlled young people advocacy groups do and provide a case for funding, expanding, scaling and or replicating these groups across the country. And I think there is such a need, given the enormity of not just health, but social challenges that Indigenous young people are facing, but also to be in charge of telling their own stories and sharing their own strengths, because there's a lot in the media that tells young people, that Indigenous young people, everything that's wrong with them and not enough about what is amazing and wonderful and exciting about their futures. And I think that the people that are best placed to do that are those people themselves. So that's what I'd love to see.
And I guess thank you for that, Jordan. And I think for us too, I guess for context to understand who we are. So we're a policy and advocacy organisation based in Victoria with a staffing structure currently of 10, so quite small, and doing statewide pieces. We're in a position now where all of our staff are under 30, and all but 2 of our staff identify as Aboriginal or Torres Strait Islander. I think there's an assumption that being the Career Youth Council that we are young people, but I just also like to emphasise that currently, yes, we are. And also we get advice through different structures. So we hear feedback through young people in communities around what's important to them, which was around how we came up with the Nugget report. Was our young people going, we want to hear from the young people that are impacted, not everybody else telling us. And I think that that's important, because we always say, how do we give young people a voice? And any of the listeners here that have your own children or young people in your lives, young people have a voice. I think it's up to us as adults and as experts and in these privileged positions to elevate those voices and experiences. And I see that's the work that Career Youth Council gets the privilege of doing every day. I get to sit in a lot of spaces whether that's with government and key decision makers or whether that's with our community-controlled organisations, making sure that when we are talking about young people, that we can actually bring those voices to light. And ideally, some of those times when we think about that, who's missing in that chair, sometimes like examples of that have been bringing in young people to those discussions to talk directly. It doesn't have to filter through me, but being able to have that separation can create that safety as well. So I'd love to see all young people getting access to spaces like this and organisations like ours. And I think as well, like we've been doing this for over 20 years and this has come from our community as well. And I think that's when we talk around the importance of Aboriginal-led responses and how Aboriginal communities are starting these discussions a lot earlier, where there was a lot of community in Victoria, those that might be aware of the ATSIC days, the Aboriginal and Torres Strait Islander Commission. There's a lot of discussions around young people, and in Victoria, the leaders there at the time go, how do we hear from these voices? And that's how we came about. So we're established as the Victorian Indigenous Youth Advisory Council and been in a position to grow as one staff and a network of volunteers. And I think to see that continuing is incredible, but I also see that there's so much missed opportunities in other spaces. And yeah, I think we can always do better. And I think that partnerships piece is a huge part of that. How do we partner with the right spaces and the right people and the right organisations as well is huge. So yeah.
And I'd just like to say as well, around how much we have to learn from young people. And going in to write this paper, I liked to consider myself still reasonably young, but working with such amazing Indigenous young people, I learned so much and was challenged so much about in my own biomedical training. You know, there's the pushback on, no, we don't want to use statistics. And I was like, oh my gosh, how am I going to write this without using statistics? How are we going to share this story? How are we going to share the work that's being done and the reasons it's being done without using statistics? So we workshopped that. There was pushback on using the word youth because the word youth is, when it comes to Indigenous children and young people, isn't associated with sort of stories of strength and is usually next to the word crime rather than positive stories. And so KYC said, no, we're not going to use the word youth in this article. We'd like to be referred to as young people. And I was like, okay, like that was pushing me. I learned so much about the importance of language, the importance of letting young people tell their own stories, of how important that framing is to creating environments where young people are enabled to share their own stories and strengths and what they want for their futures and how they can see their health and outcomes improving.
Thank you to my special guests, Dr. Jordan Corey and Bonnie Dukakis. You can find more podcasts on our website at mja.com.au or wherever you find your podcasts. Thank you so much for listening.